Hi, Roxy. My name is Casey. I'm a second-year nursing student, and I'm going to be working with you today. Is that okay?
Yeah, that sounds good to me.
Great. How are you feeling?
I'm feeling really good physically. It's been exciting being with the little baby here, but I'm honestly starting to feel like pretty nervous because we're going home tomorrow, and just like the stresses of going home is a lot, and it makes me kind of want to smoke. I have a history of smoking, and I didn't smoke for the entire pregnancy, which has been really hard, but definitely worth it. And but I just was reading a pamphlet because there's so many of them around here, and it said that like if I start smoking again, it can be really harmful for my baby. And I just want to know, like, if I do start smoking, like I'm pretty stressed out right now. Is there any way that I can minimize the like health risks for my baby? What do you think?
The nurse identifies the need for education about quitting smoking and healthy habits in her process of quitting.
All right. Thank you for bringing your concern to my attention. I think that the healthiest thing you could do is to continue to avoid smoking. It sounds to me like you're already on the way to quitting smoking, and you're hoping to continue with that. Is that right?
Yeah, I think that's the best option for me right now. It's just hard because I've tried to quit so many times in the past, and like I think this time I'm really on a good track. But do you have any useful tips as a medical professional on how best to quit?
Yeah. So I have some resources that have helped many others quit smoking. The website quitnow.ca is an excellent personalized program geared to help people quit smoking at their own pace. It helps you prepare, learn your triggers, conquer cravings, and manage withdrawal symptoms associated with smoking. I'd really encourage you to check it out.
Yeah, that sounds good. I'll have to remember that one.
Yeah.
I understand that I am in the process of quitting smoking and everything, but I'm worried that I might go back to it and then slowly wean myself down. I'm not sure if I do happen to smoke. Do you have any advice on how to keep my baby healthy?
Good question. So your baby is sensitive to the environment around you guys. It's really important that you're smoking away from your baby, preferably outside. Do you know about second and third hand smoke?
Not really, no.
The nurse identifies specific strategies to keep the baby safe from second and third hand smoke.
So secondhand smoke is the physical smoke in the air around you as you're smoking. Third-hand smoke is the residue of smoke that's left on your skin and clothes after you smoke. The key in preventing your baby from breathing in secondhand smoke is smoking away from your baby.
Okay.
In order to reduce transmission of third-hand smoke to your baby, you could think about possibly wearing a designated jacket or sweater when you smoke and taking it off before you come inside. You should also always wash your hands after smoking and before touching your baby, as well as regularly cleaning surfaces in your house with a soapy cloth.
Yeah, that sounds very doable. I've heard, reading the pamphlets and everything, I've heard that cigarette smoke can pass through to my baby when I'm breastfeeding. Would that harm my baby? Do you know anything about that?
Good question. Secondhand smoke can be a danger to a baby. Nicotine and other harmful ingredients in cigarettes pass through breast milk and can affect your baby. Smoking can also reduce the amount of milk you produce and can make your baby fussy and irritable. Remember what I said previously about how residual smoke can stay on your hands and your clothing. The same strategies I already mentioned can help you to keep your baby safe and healthy.
Man, those are that's some great information, good to know. I'll definitely have to utilize that in my life.
I'm glad you find them helpful. Remember that formula feeding is an option as well, but I'd really encourage you to talk to your doctor about that if you're continuing to smoke. I'd also encourage you to look into alternatives to cigarettes through your doctor. But right now, I'd like to talk to you about some healthy activities you can do at home to reduce your stress levels when you feel like they're high. Is that okay?
Yeah, that sounds really good. I would definitely love to hear about some of those. I know I definitely need a healthier alternative to figure out how to cope.
The nurse educates the patient on healthy coping strategies.
So there's some activities you can participate in at home, such as yoga and meditation. You can get a yoga mat from the dollar store, and you can find tutorials for both meditation and yoga poses for free on YouTube. It's also important to get enough sleep and to eat good food during the day. These things seem simple, but they can greatly reduce your stress levels. Also, having strong relationships with others can help you manage your stress.
Okay.
If there's ever a time where you're feeling really overwhelmed or like you need a break, you could call in a close friend, a relative, a trusted neighbor, really anyone you trust, to come in and watch your baby for an hour or two while you take a nap, go for a walk, go for a drive, whatever it is. Just take a little bit of time for you, and don't be afraid to reach out to your connections. I have a pamphlet with more information if you'd like it. Do you have any questions about that?
That sounds really great. I'm very interested in that. I'm excited for that pamphlet. Thank you.
Yeah. Do you have any more questions for me right now regarding anything else we've talked about?
You know, I think I'm doing okay. I feel a lot more confident taking my little guy home here. So, yeah, thank you. You did a great job.
Great. Okay. I'll see you guys soon.
Yeah, we'll ring you if you need anything.
Sure.